Hello, my name is Jen Loki. It is the 8th of November, and this is my model today. This is my surface anatomy model, Kai, and he is my firstborn offspring. And all right, I just have this list of things that I'm going to talk about on my other side of this. So first, the importance of surface anatomy. It is really important, especially in the case of some sort of emergency where a surgeon needs to make a quick incision. So if you need air into your lungs, or if you need the Heimlich maneuver or something like that, knowing where those landmarks are so that you don't mess up and accidentally kill someone. But even simple things like knowing where to find a pulse on somebody is more exact if you have some of those landmarks picked out. So surface anatomy, important. Okay, 5 different examples. The first is the zygomatic arch, or the cheekbone. So the prominent part of the zygomatic bone, part of the skeletal system. The second one is, we're so well practiced, is the thyroid cartilage, which is superior to this cricoid cartilage. And if you swallow, there you go, you can see it elevate. So that's the thyroid cartilage right there. The head of the ulna is this. Oh, by the way, the thyroid cartilage is part of the respiratory system. It's on the trachea. The head of the ulna is right here, part of the skeletal system. I forget if I said if the zygomatic arch was part of the skeletal system, but it is. So either way, there you go. Zygomatic, skeletal, thyroid, respiratory, and head of the ulna is skeletal as well. And then we have the tendon of the flexor carpi radialis. So it's always a little, there we go, okay. There we go. So the tendon is sort of the large one that you can see. There we go. So here is the tendon of the flexor carpi radialis, part of the muscular system. And in a minute, we'll explain why this is an important anatomical or surface landmark for anatomy. And then last, number 5, is the calcaneal tendon, or Achilles tendon, which we're going to show you down here. Yep, so this prominent back end, so the most posterior part of the ankle, essentially, is the calcaneal tendon. Okay, so the tendon of the flexor carpi radialis and the calcaneal tendon are both part of the muscular system, attached to muscles. So those are the 5. Yep, and Kai is reminding me, because he doesn't want to have to do this again. I know, you're very good. So 2 things I'll have to use as a physical therapist are going to be this tendon of the flexor carpi radialis is helpful to find the radial pulse, which is a nice kind of easy way to find a pulse on somebody. It's usually not too covered with clothing or anything like that. So to find that tendon again, and then go distal, so toward the thumb, you can easily find a pulse. Really nice. Yay. And I think that as a physical therapist working with athletes, I probably will have to take a resting pulse versus an active pulse or something like that at some point, I assume. So anyway, that will be a useful landmark to find that in my future career. The second one would be the calcaneal tendon. I personally have had surgery on it, a major surgery on my calcaneal tendon. As a runner, I think that that's pretty common. And just athletes in general, because it's such an avascular and sort of exposed, vulnerable spot, I imagine a physical therapist probably work with calcaneal tendons quite a lot. Because it's avascular, I can picture doing like dry needling on it to promote blood flow, or e-stim to just kind of confuse the pain receptors for people who are having a lot of pain there. Also doing some like deep tissue massage, which is super painful when you have really tight Achilles, but I had to do that a lot. So those are the two that I think that I would use a lot as a physical therapist in my practice, and surface anatomy will help me get there. So that's it.